All right, here we go, guys. I hope everybody had a great day today. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going over pain on the inside of the knee. Very common place to have pain. And as I have been talking about a lot recently and I've been asked about a lot, is most of the time physical therapy gets equated with surgery and gets equated with people walking in parallel bars. And that's not really what we do. Most of our jobs is actually fixing non-traumatic injuries, fixing injuries that people don't know where they came from. And I talk about this and I bring this up because this is really where pain on the inside of the knee comes from. It comes from some unknown place. Most people never really can describe how they injured the inside of their knee. Occasionally you can. You might have rolled your ankle or somehow sprain the ligaments on the inside of your knee, but most of the time people do not have any idea how they hurt the inside of the knee. So this is where we really come in as physical therapists in diagnosing these musculoskeletal issues that happen, because it's so important to understand how all that happens when you didn't have an injury. And if you don't understand how it happened, then while we can treat it and we'll make it better for a little bit, it's most likely to reoccur. So education and figuring out how this happened and why it's happening is such an important part of getting better. And that's really what a lot of physical therapy is. It's not just for those traumatic injuries, the accidents, the surgeries, but it's more for these injuries. And I hate the word injury because that automatically puts some sort of accident in your mind, some sort of fall. But this type of injury, this type of pain has really nothing to do with any sort of accident or injury. This is something that comes on sometimes gradually, sometimes pretty quickly. But it can be extremely intense. It can stop you from running, walking, going up and down the steps. It can cause you to limp. It can cause you to kind of walk stiff-legged. So it's important that you address it, but it's not something that you want to ignore, and it's not something that generally will go away on its own. But like I said, again, it's not something that you really will normally have a traumatic injury and then have this pain on the inside of your knee. So as we talk about in some of our other YouTube videos, and if you go to our YouTube channel, Total Performance Physical Therapy, we will address a ton of issues on the knee topic, but this one tonight is on the pain on the inside of the knee. But as we talk about in all of our videos, the knee is really the hub between the hip and the foot, which makes it very difficult and very complex to understand. So when you're talking about pain on the inside of the knee, you're talking about problems going on at the foot and problems going on at the hip. One or the other or both is occurring. So nothing's really occurring at the knee per se. You have to look at the foot, you have to look at the hip in order to be able to figure out exactly what's going on the inside of the knee. If all you do is focus on the inside of the knee, nothing's ever going to get better. Nothing's ever going to, they may feel better for a little bit because you're putting some anti-inflammatories on there, or you're doing something to just specifically address the inflammation at that spot. But if you don't do anything to address the foot and you don't do anything to address the hip, and find out what's causing it, is it one or both of those, then that pain is always going to be there and it's going to become very intense. So it can be a pinching pain, it can be a stabbing pain, it can be a dull pain, it can be a pain up into your groin, it can be a pain down into your calf, into the side of your leg. There's a very broad wording for what this pain on the inside of your knee can feel like. So when we talk about what can go on at the hip, if you do not have strong enough muscles to maintain your knee as you walk, you can wind up really increasing the pain and how much pressure you put on the inside of the knee. You can wind up putting a lot of pressure on these adductor muscles, ADD muscles. And what's going to happen is, as these come down and attach on the inside of their knee, as they get tighter and tighter and tighter, it's going to cause this muscle to really become inflamed and really have a lot of knots, and you're going to feel a lot of pain in through here. On the other side, you're looking at a tight IT band. These muscles can respond in response to this being tight. So a lot of people, especially if you're a runner, you've heard the IT band come up several times. It's this big, massive band on the side of your leg, and it can become very, very tight. You need to foam roll it, and you can refer to our YouTube channel, Total Performance Physical Therapy, to learn how to do that. But on the inside of your leg, in order to kind of the yin to the yang, these will become very, very tight as these become tight also. So, and a lot of times we don't do anything to strengthen the inside of our leg. We kind of let it go and it actually becomes weak. So tight and weak equal pain, because all of these muscles come down here and attach on the inside of the knee. So again, that inner knee pain, that pain on the inside of the knee, has nothing really to do with a specific muscle or tendon going or at the knee. It has things going on down or up at the hip that are traveling down into the inside of the knee. Now let's talk about maybe the foot. Let's say you have a flat foot, for instance. When you have a flat foot, you tend to what we call overpronate. Your foot tends to roll this way, all right? If you have a flat foot, you're generally an overpronator. When you overpronate, your knee goes in like this. This puts tremendous pressure on the inside of your knee. So if you aren't walking in correct shoes, if you aren't walking with correct orthotics, if you need them, you're going to have an issue on the inside of your foot. Let's say you have plantar fasciitis and you're limping. It's going to impact the inside of your knee. However you're changing your foot, however your foot is reacting, affects your knee. It could affect the outside or the inside. We're just specifically talking about the inside. But that type of inflammation, like a plantar fasciitis or a flat foot, causes increased strain on the inside of that knee. And again, if you don't treat the foot and all you do is just put some cream on there or try and treat this, you're going to have zero success. So the inflammation may come down for a minute, but it's going to come back with a vengeance. So you always want to make sure that you are constantly trying to find out the cause of the problem, because that's going to make the biggest difference in treating the issue. So what are a few things you can do? Well, first of all, if you've never had your foot evaluated, you need to go get it evaluated. Go to your local running store, have them look at how you walk, have them see what type of shoe is beneficial for you. If you're having pain on the inside of the knee, I do not recommend wearing flats like I am doing right now. I do not recommend going barefoot, and I do not recommend flip-flops. If you're having pain anywhere on your knee, not just the inside or the outside, get into a good pair of sneakers and stay there until that pain has come down. Let your foot naturally be able to react to the ground in a sneaker, and then you can take it off and start walking barefoot again. But give that support to your knee, give that support to your foot, whatever it may be. Maybe it's cushion, maybe it's stability, and again, you really need to be fit properly for a shoe in order for that to be established. So that's number one. Number two, you want to look at strengthening your hips. So we're going to talk about strengthening the inside, and we're going to talk about strengthening the outside. So strengthening the outside, which is really actually your glute medius, which is generally one of the weakest muscles in the body. And when you have a weak glute medius, kind of everything on that lower leg goes in and it collapses because that glute medius isn't strong enough to hold it in place. So a very easy way to train your glute medius is you're just going to stand on one leg and then you're going to do a hip hike. Okay, it's not a huge movement, it's just a little movement. You're not bending your knee up and down, you're not moving your knee at all. You're just dropping your hip down, trying to keep your balance, not like that, and then you're raising it up. You're dropping it down and you're raising it up. You want to continuously do this because it's not a weighted exercise. You want to do this for about 30 reps, and you can do about 3 sets of those. You're going to get fatigued on this leg. This side, generally the side moving up and down, is not going to feel a whole lot of fatigue. But you want to do it slow. You don't want to just rush through it. You want to make sure that you're going all the way down and coming all the way up in order to make sure that you're getting some good strengthening on that glute medius. And you want to do more endurance. Don't start adding leg weights or anything like that. Stick with those 3 sets of 30 seconds. You really want to make it challenging. Stand on a pillow, close your eyes, but that will help. But again, maintaining that single leg balance and dropping that down and bringing that up. You don't want to lock your knee out either. You want to keep it nice and bent, okay? But it doesn't move for the entire exercise. When you start on this exercise, some of you may just be here, okay? A lot of times this is a very difficult exercise. Or people are doing this, and they're moving like their whole body in order to get their hip to activate. You don't want to do that. You want to keep your shoulders still. You want to keep everything still except your hip drops, and then it comes up. And it drops, and it comes up. The knee stays completely still. You just don't want to lock it out. The next exercise for the strengthening of the inside of your leg. Now, if it hurts to do any of these exercises, obviously don't do them, but all you need to do is just start with your foot like you're going to put your shoes on, and you're going to bring your knee up to do so. And all you want to do is just lift it up and down, and up and down. And it's important that your toe stay out to the side, okay? The minute it starts to turn this way, you lose that strengthening. So you're just going to turn it as far out as you can. Hopefully it faces that wall, and you're going to lift it up as high as you can and back down. And lift it up as high as you can and back down. Now, to challenge yourself, you can do this without holding on. If you don't want that extra challenge, you can hold on to something. You want to, again, hold this up there for about 3 to 5 seconds and then lower it down. You don't want to do this. That's not going to help anything. You might actually wind up pulling something, or even worse, tearing something if you try and really rush through it. I don't recommend adding a whole lot of ankle weights to this. If you can get through 3 sets of 30 where you're really coming up high and lowering it down nice and easy, maybe a pound or two, but nothing crazy. You can hurt yourself, so I would really recommend not putting on any ankle weights, just simply doing that exercise. The last exercise I'm going to show you is just a simple stretch. You want to just stand with your legs as far apart as you feel comfortable. To stretch the inside, you're going to bend the opposite knee. You want your toes pointed forward, your feet flat on the floor. You want to stay standing up nice and straight. If you want to bend forward, that's fine. Just make sure that when you bend forward, you're hinging from the hips. You're not dropping down like this. This leg stays straight, all right? And you're just going to bend until you feel a stretch. You can feel a stretch anywhere from here all the way up into your groin. Should not be painful, should not have numbness and tingling, but you're going to feel a nice gentle stretch in through there. Again, keeping your toes pointed forward, super important. You can put this leg that's staying straight up on a step for a little more intense stretch if you don't feel anything as you go down, but you just want to feel a good stretch. You want to hold that about 30 seconds, and you want to do 6 of those. Anytime you feel pain in your knee, you have to understand it's probably coming from either your hip or your foot or both. And not diagnosing exactly where it's coming from fails every time in actually being successful with treatment. So make sure you understand exactly where it's coming from and whether it's a hip issue, a foot issue, or both. If you or someone you know is suffering with knee pain, wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.